Thank you. We have that, everyone has that Zoom stare. I have it myself. Are we ready to go? Happy New Year, everybody, and welcome to our first rendition of 2021. Thank God we're here in 2021 and we can talk about all things COVID. I hope that you all had a restful and peaceful few days over the holiday. A lot of work was going on here. I think our intrepid nurses and volunteers on contact tracing, I think they did take off Christmas Day between 11 and 1, 11 a.m. to 1 p.m. Then they got back on it. And I think that they taken off sometime on New Year's Day, but the work they're doing is invaluable. And for those of you that have received calls from them, really is a lot of information. And I thank the public for the most part for really corroborating with us and cooperating with us, because it's not so in a lot of communities, from what I'm hearing from my compadres. It's very important to help stop this spread to the extent we can. I think it is at least positive that we see a light somewhere at the end of a very long tunnel, and maybe that tunnel is, we don't feel we've made a lot of progress over the last couple of weeks, but there is a light at the end of that tunnel, and it's nice to talk about some things that are maybe are going to resolve this as we go forward into testing and what have you. But maybe if we could put up the numbers there. Ryan, do you have them? I'd like to start here. Thank you. So as you can see, Wakefield, like I believe it's 219 other communities in Massachusetts, and maybe I'm wrong, that's what I thought I heard this morning, are in the red zone. That is certainly disheartening, but so we are seeing that. You do note that the governor did make some changes, restrictions, and has extended those restrictions. So capacity at 25% at most businesses, including restaurants, and capacity of 10 at your house. I can't imagine that I've had 10 at my house, but I think some people have, I'm certainly sure. And that's extended through January 24th at the latest. But in spite of that, we've done a lot of testing, and we did testing for town residents and employees. And I think we had probably 1,400 or so people tested in town, free testing, and that went very well. I want to thank Ruth and Tom for setting that up, and all of our staff that basically volunteered to help that, and particularly Cataldo Ambulance that put that through. And, you know, there were a number of people that were asymptomatic and found out that they were positive, but that was really what that was all about, right? Was to try to keep people safe. So we're sorry if that made any of you, gave anybody angst. That I know a few people found out they were and were not happy, but better to know than not to know. Can we put up the map to show the other communities now, Ryan, if you don't mind? Thank you. So you can see where Wakefield is. You can see the state is pretty much experiencing everything. I think Wakefield's positivity rate over the last 2 weeks is 6.95% that you saw on the previous screen. And as high as that is, a lot of our communities around us are in the same ballpark or a little bit higher. But you know, we just got to keep vigilant and continue to wear a mask. So I think I've said enough there, and hopefully I'll turn it over to Ruth and then to Tom to talk about, you know, some of the positive things that are going on, not rates, but positive things that are going on with our starting to get vaccines and starting to vaccine some of our first responders. So Ruth, why don't we go to you first?
Great, thank you, Steve. Yes, actually on Monday, we received 1,200 doses of the Moderna vaccine. We took pictures, actually. We took pictures of the UPS guy making the delivery. And I don't know, it's just me. So yes, we do have our first shipment of vaccine. It is reserved for first responders, and we are doing this in conjunction with our public health coalition. So first responders have been given the information about where and how to sign up. There'll be 3 clinics next week in Melrose, Medford, and Malden. There are 6 communities involved that the first responders will be able to go. They've all been given that information, and we're starting to get the signups. So that's very exciting. We get a lot of calls, as I know the town administrator's office does, from the public about when are they going to get tested. And the answer to that is they will get, sorry, not tested. I'm in the middle of testing and vaccinating. When are they going to get vaccinated? And the answer to that is they will get vaccinated in the order of the categories that are listed on the state website. So if you go to www.mass.gov, mass as in MASS.gov, and type in, when can I get vaccinated? It will bring you to that part of the website. It has a great infographic, which we also have on our town website, that shows the 3 phases and groups within those phases. Phase 1 has 6 groups, where first responders are the 3rd group down, and that's where we're at right now. So once the third group is well underway, we go to the 4th group, then the 5th group, then the 6th group. Then we go to phase 2, which is the beginning of the general public. So we can tell you what order the groups are being vaccinated. We can't tell you what time or date that's going to be, because it's dependent on how quickly the group before you is vaccinated, and part of that is dependent on how much vaccine is shipped to Massachusetts. So those are variables that we cannot tell you for certain right this second or at any point. So that's why it's important to keep monitoring our website and the state website. Please be assured that when it comes time to be vaccinating the general public, that will be well communicated. Our communications director, Jen, is fabulous, and the information will be out everywhere we can possibly think of to get that information out. So people will know when it's their time and how to come to the clinics. And it most likely at this time will be the Moderna vaccinations, which is 2 shots, 28 days apart. And you're not considered fully vaccinated until you have your 2nd vaccination, and then wait 2 weeks for your immune system to kick in. So the process really is a 6-week process. I think I covered the vaccination part.
All right, Ruth, thank you very much. Tom Walsh, can you jump in?
Sure. Emergency management, we've been working on making sure that the town is safe as far as our employees, all departments, and then able to assist the public. And I think on that end of it, we've been very good. Emergency management in the next few weeks will be assisting public health with planning and coordination of the vaccinations for the town. So that'll be our biggest endeavor, right, for the next, at least the next 3 weeks, or probably longer, to get that up and running. It's going to take some time. But I also want to mention this, that, as I don't know if Ruth had mentioned, but we've had a pretty good spike in because of the holidays of the cases. And the CDC has not asked people not to do things. They've asked them, and it's still there. Please don't travel. And if you're going to be with people, stay with the people that you live with. The reason that we have these spikes is because people are not adhering to taking care of it. And unfortunately, this is what's happening, which increases the amount of people that have to go to the hospital. And, and there's a strain on our state government on taking care of it. So I just like people to please do the best you can. I know it's a long process. We've been doing this thing for almost a year, but there is a light at the end of the tunnel, long tunnel, but please, if you can do it, it's an unselfish act to do it, but please, I'm just asking people to do that.
Thank you. Thank you, Tom. Town Council Chair Santos, looking great this morning. Do you want to give us any words of wisdom?
Thank you. Well, not unlike how I run my meetings, and to take away the stigma, I've tested positive this week with symptoms, feeling quite ill, as did some adults in my family. And we did everything. So we didn't have family over for the holidays. We didn't, I've only gone out grocery shopping. I wear my mask everywhere and it's still snuck in. So I think even for those of us that have really tightened the bubble around our family and have done for a long time, just pay attention to symptoms. And if no one's getting bad colds, I don't think right now. If you have that, it's probably COVID. So I just think there's no shame in testing positive, and it's good to know. And, isolating and quarantining right now, I can tell you it's not easy. It's not easy with teenagers in the house. God bless any of you who have to do it with them. But it's, knowing that we know we're trying to keep everyone else safe is really important. So even if you have been careful, just keep an eye on symptoms, because I think it's sneaking in where you don't expect it to sneak in. But we're feeling better, which is great. I have utter faith in my town and got welcomed the chat with the contact tracing from the Board of Health, which was awesome. So I think we are doing as a town everything we can do. And we thank you, the citizens out there, for also doing your part.
Thank you. And I would remind, it's a good point to remind that anybody that has older members in the family that are more susceptible, there are some very uncomfortable conversations to have, including telling my mother this morning that the sale on mushrooms, 3 for $1 at Market Basket, was not worth her going out or her husband going out, who are in their 80s, to save a couple of bucks. So she's got children and grandchildren that are able to help them. So that's something, and I know that we're a great community and we're doing that. Let me jump over to Laurel from the Board of Health, and then I'll jump over to Doug.
Good morning. Anne, thank you so much for full disclosure. I think, we do need to give each other a break. This is a sneaky virus, and, mass mitigate. And, and there is some research out there that if you lower the dose of the virus, you may not get as sick. So even though you're sick, the fact that you've taken the precautions that you have may have made it just gold and nothing worse. But my heart continues to ache for our frontline workers in the hospitals. I'm a little concerned about putting on, increasing nurse patient ratios, but I'll address that. And we have a noon conference call with Senator Lewis, because that's meant in an emergency, which this is, but this is the longest emergency on record. So I'm a little worried about that. So walking that all the way back to please doing your part and being careful, because these frontline nurses and medical personnel are having a tough time, and the numbers are as bad as they've ever been, and they've been at it nearly a year. So don't forget to take good care of your neighbors who are in the field, and kind of just give them a heads up, because they're tired. Thank you.
Thank you. Thank you, Laurel, and thank you for all the work that the Board of Health has done supporting the town efforts, and certainly the town council with our wonderful chair, who really has supported us down the line. Doug, what's happening in the world of education?
Oh my goodness, we're busy every day, which is good. Good morning, everybody. Happy New Year. I think it's good to be back. I think from all of our teachers and our administrators. I think the break did us well, served us well, and I think we were very, very happy to welcome children back to the hybrid plan this week. And so just a quick update and a reminder, we have not updated our data on Fridays. And this is the third Friday, right? So there's been a little bit of a break in kind of our reporting on this call, right? We sent an update out on the 4th of January, and we sent an update out again this morning. But in January, our number of positive cases, student cases are 37, and our number of positive staff cases are 10, right? And so in the information that I've shared, we've also kind of changed the format of the letters that we're sharing with the community. We've inserted a table in there to hopefully make the data a little bit more accessible so you can see what schools have positive cases and what that might look like. We're also including in that information that we're sharing in our letters the number of students and staff in quarantine, right? And so we've had a dramatic uptick this past week in the number of people in quarantine. I think we started the week at around 50, and we're ending the week around 227 students in quarantine and 18 staff members in quarantine. And so our nurses, who I need to kind of give a shout out of thanks to them, our nurses kind of disaggregate the information with personnel that are in quarantine. So we can see of the 227 people in quarantine, just about half of them are directed by the Board of Health. And what that means is that there's been a direct contact, and the Board of Health has been able to contact trace and reach out to them and let them know that they need to quarantine. The other half of those students and adults, the other kind of half of that group are students whose parents and families are keeping them home as a precautionary measure. They're keeping them home because they're symptomatic, or they're keeping them home because their families have traveled, right? And so that's exactly what people are supposed to do. That's what the CDC guidance is. That's what the state guidance is. And that's what our Board of Health and school nurses have been promoting since the start of the year. So when we get questions like, how do we know if people travel, if they're staying out of school or following the guidance? Our nurses tracking the quarantine data is kind of real-time feedback, letting us know that families are making really good decisions and working hard to keep themselves safe and to keep other members of the community safe as well. And so that's an important piece. Just a few other pieces of news. We had a little bit of an uptick this week with our sports teams. And so this past week, we've needed to quarantine our freshman girls basketball team, our boys JV hockey team, and our girls hockey team. And that's not because there were positive cases in two of the three. There was one positive case on each team, and then we did contact tracing, worked with the Board of Health, and ended up as a safety measure quarantining the entire team. On the girls' side, they had a contest against Watertown. There was an athlete on the Watertown team that tested positive. In contact tracing, we again took the precautionary measure of quarantining the entire team. So that's really important. On Thursday afternoon, we host a call with parents in the community. And one of the questions that we got yesterday was, have we given thought to shutting down athletics, or has that been a point of conversation? And the short answer is yes, we have. But the challenge for us is number one, there are a few positive cases. And number two, when teams are successfully able to practice and compete, to just shut those teams down that are able to successfully do this safely, it would penalize those students, those coaches, those teams, those athletes. So we're trying to do the best we can, like all districts in the Middlesex League. We're doing the best we can to keep things going as long as we can, which just brings me to my final remark, which is with the high number of cases, we do need to be prepared to scale back if needed, right? And that really the two reasons that we would scale back is number one, in our collaborative work with our local Board of Health. If we can't effectively contact trace, if the numbers coming in are so great that we can't effectively contact trace, meaning we don't know where the transmission of the virus is originating or where someone might have been infected, we would scale back either a given school at any level or the entire district if we needed to. But that decision would be made based on the data, and it would be made in collaboration with the Board of Health. The other reason why we might scale back is due to a high number of cases at a given level, given school, and also difficulty that we might have with a high number of cases with adults, with faculty and staff. If we have a high number of faculty and staff that are either in quarantine or are resulting in positive cases that impact our ability to safely staff schools, we would scale back. But we would articulate that in our weekly communication. And so that's a very quick for us. Sorry I took so much time, Steve, but,
Oh, no,
but
not at
that's
all.
where we're at this point.
Great. Let me go over a couple other things that are going on. People may recall that when the first relief package came through the CARES Act, there was a date given to all of us that all funds needed to be expended by December 30th of 2020. Kind of an odd date, and we kind of laugh about that. But I got to say that we took a very prudent look at this. We didn't go out and spend things that we didn't think were necessary or willy-nilly, or that weren't really part of the whole COVID program. So when the new package came through that was voted on, I guess a month ago or a few weeks ago now, that although did not have any extra money for cities and towns, did extend that date through December 31st now of 2021. So we are still able to access funds that weren't used by the end of December of this year. And I think we always knew that was going to happen. I know Tom and I and Ruth and Kevin Gill and Chair Santos have spent a lot of time talking about this, and we did think that that would always happen. Unfortunately, some of our neighbors have spent all their money already, and maybe on things that maybe they aren't as important in our opinion. So we do have some access to funds there that we will be looking at prudently. We'll also be looking at getting reimbursed through FEMA to get also some funds for things that we spent money on through this pandemic. So financially, I think we're in good shape. Knocking on wood for the moment. But there are some other things going out because there are members of our community that really do need help. And I'm going to throw this out. Please remember the food pantry. There are a lot of families in town that are really relying on that right now. So if you have a little bit of extra money, and even if it's $10 given in the food pantry accounts for $40 worth of food. They get a 4-to-1 ratio. So consider that in your giving. Another thing is our emergency fund. Our emergency fund gives help to Wakefield citizens that are hit with something. We've done a lot of help with people paying their rent or mortgage. There was just a fire the other day, and we got about a week ago, and we're helping those people there. You can drop off checks to town hall on that, and we can put it in there. We haven't forgotten about our business community, and Erin Kokinda has done a great job, and we'll be actually going, she more than me, I've gone to a few door to door with some great grant programs that we do have coming up, not only in how to market yourself, but there's a recent grant program that came out that marketing yourself is the town's doing that, helping them be digital marketing, but there is a state program where these businesses can get up to 3 months worth of operating costs or $75,000, whatever is the most, to help them out during this time. Mainly centered around, restaurants and retail that have really suffered under this. So please, if you are in business and listening to this, so you've heard anything, the items are on our website and we put it out on Facebook, but these are some important parts here that will help the rest of our community. So in that, and I'm always available, really anytime to call as our people here. Anybody else have anything to add? No, I see no's.
I'll just add in real quick. First of all, about the digital grant program, being online was pretty critical to business a year ago, and it's really critical now. People want to shop online. They want to order their takeout online. You're not bumping into someone hearing about a great restaurant. You're hearing about it on social media. So the nice thing about this program is that the businesses can take advantage of the webinars and learn, even if they don't want to utilize the grant money to implement what they've learned. So if you have a really old website, or if your menu is just a PDF and you want it to be interactive, this is really a great program. It's pretty exciting. The other thing I just want to say is the census, the town clerk census has gone out, and I guess we're getting a lot of folks wanting to come in to drop off their envelope. And I know that tax bills have gone out too. So just a note that we upgraded our mailboxes outside. They're big metal black locked mailboxes, and they're all clearly labeled so that you don't have to come in, maybe feel uncomfortable in a public building. You can check them out on the side of the building.
Right. And for your census, it clearly says town clerk. Put it in the town clerk's box. That was
Yep.
another conversation with the mushroom lady this morning, what she did with it. So.
Town clerk.
Town clerk. Anything else from anybody? Great job by your team in Wakefield, and great support from the community. We hope to have more information regarding vaccination for more of the public as we go forward. As Ruth said, I will tell you that this is a day-by-day changing moment for, poor Ruth. I think one day that she has something at 9 a.m., the next day there's another webinar, and everything changed. So we are rolling with the punches. We're nothing but resilient here. And but I think that there will be some news coming out in the next few weeks about how that is going to be disseminated. So until then, stay safe. Please wear one or two of these when you go out. It really does, as Laurel said, it hopefully at least knocks down the severity, if not keeps you completely safe. So not too hard to do, right? We're almost there. Thank you, and stay safe, Wakefield.
Thank you, everybody.
Thank you. Great day.